Module 5 is entitled Perspectives in Abnormal Psychology. A clinical intervention is a procedure or approach implemented in a clinical setting to improve, maintain, or access a person's health. It involves actions designed to have a specific outcome, such as treating a condition, managing symptoms, or enhancing overall well-being. These interventions can range from medical procedures and medications to behavioral changes and counseling. Here's a more detailed breakdown of the clinical interview process. First, identification of a problem. The process begins with identifying a specific health problem or issue that requires intervention. This could be a medical condition, a symptom, a behavioral concern, or a need for specific care. Second, assessment. A thorough assessment is conducted to understand the nature, severity, and potential causes of the identified problem. This may involve gathering information through medical history, physical examinations, diagnostic tests, or behavioral observations. Third, goal setting. Clear and specific goals are set for the intervention, outlining the desired outcomes and improvements. These goals should be measured and achievable within the context of the intervention. Fourth, plan development. A comprehensive plan is developed outlining the specific steps, procedures, or strategies that will be used to achieve the set goals. This plan should consider factors such as the individual's needs, preferences, and resources, as well as the available evidence and best practices. Fifth, implementation. The intervention plan is implemented with regular monitoring and evaluation to track progress towards the defined goals. This may involve administering medications, performing procedures, providing counseling, or implementing behavioral changes. 6. Evaluation. The effectiveness of the intervention is continuously evaluated to assess whether it is achieving the desired outcomes and if adjustments are needed. This evaluation may involve monitoring the individual's progress, collecting data, and conducting follow-up assessments. 7. Modification. If the intervention is not achieving the desired outcomes, the plan may be modified or adjusted based on the evaluation findings. This may involve changing the intervention approach, adjusting the dosage of medications, or implementing additional support services. And 8. Outcome assessment. Once the intervention is completed, a final assessment is conducted to determine the overall impact and effectiveness of the intervention. This assessment helps to identify lessons learned and inform future interventions. Upon completion of this lesson, the student will be able to explain the clinical intervention process. Identify the goals of clinical assessments. Recognize how clinicians arrive at a diagnosis and treatment plan for a patient. And apply clinical interviewing techniques.